um, everybody has some underlying asymmetries in their face that they're congenital. When we're young, because the fat pads are very full and there's not a lot of separation between the different parts in our face, it's well hidden. So that's why we're not so aware of those asymmetries. As we get older and we lose the volume and the elasticity of our skin becomes worse, those become more apparent. So we're more prone to seeing asymmetries on both sides of our face as we age. So we're going to start from the top and work our way towards the bottom. So let's talk about the forehead first. It is very common to have hollowness in the temples as we get older. And actually, Anna does not have a lot of that. So I'm going to have you turn to the side. So what you want to see is that there's a smooth transition from the forehead onto the cheekbone. In women, you want this to be just very slightly concave or flat, because having a convex surface here is going to make it look masculine. On the other side, the same thing. Anna has a really nice smooth transition from the forehead to the cheekbone. So what this tells me is actually I can add a little bit of volume to her cheekbone without worrying that it's going to accentuate any hollowness. I always look at these areas together, because if a patient is going to have treatment in the cheekbone, in the lateral cheek here, and they already have some hollowness here, it's going to accentuate it. The same thing in this area in front of the ear. It is very common to start losing volume right over here, and you can imagine that if I fill this and give it more projection, it's going to accentuate the areas of hollowness above and below. So you can never treat a single part of the face as one unit. You really have to think about the adjacent units, because what we're trying to really restore is this smooth contouring where one part of the face flows smoothly into another part of the face rather than having them be segmented.